Hi, my name is Dr. Chris Outten. I'm a chiropractor in Cary, North Carolina, now for 25 years. Today I'd like to talk to you about some common compartment syndromes that a chiropractor sees in their office. Specifically, I want to talk to you about carpal tunnel syndromes. Patients commonly come into our office with wrist pain, numbness and tingling in their fingers, weakness in their hand, pain radiating up into their forearm, and they're not really sure why. So we do a complete history and an examination to determine what activities of daily living may be aggravating their wrist and forearm. Also the examination to determine what tissues are involved in the condition. So the carpal tunnel is a little canal where the arteries, nerves, and veins run through. And because of poor posture and repetitive stresses we put on our forearms and our wrist, we close down that carpal tunnel and encroach or pinch the arteries, nerves, and veins and develop these symptoms. So in a chiropractic office, typically after the examination, the treatment consists of extremity adjustments, making sure the elbow and the wrist are functioning properly. We may do a little therapy to calm down some of the symptoms, like interferential muscle stimulation or laser that we do in our office. And we also give the patient stretches to do to help loosen up the area and prevent the condition from happening in the future. So some of the stretches that we do, and we recommend anybody who's doing any repetitive activities such as working on a computer, people work with tools. We want to have you keep your wrists in a neutral position, not cocked up or flexed forward for any length of time. But the stretches that we give you is first stretching down like this. We need to stretch the flexor muscles of the forearm. Then we have the patient stretch like this to stretch the extensor muscles. Many people can develop tennis elbow or golfer's elbows from contracting those muscles all the time. Then we stretch this little bump that we have on our palm called the thenar eminence, and we pull down. And all these stretches need to be for 20 seconds and continuous. No bouncing of the stretches. Then what we do is we spread our hand on a table and lean over and really try to spread our fingers apart, which is an overall stretch for the hand. And one other one is to stretch the muscle that goes across the forearm, called the Pronator Teres. This is the muscle that allows us to pronate. And many of us pronate, like working on a computer, all day long, and it can entrap the nerves, arteries, and veins. So you grab a table and you just turn out like this and hold it for 20 seconds. Once we calm things down and we start to stretch and strengthen those areas, and we improve the patient's posture and their activity that's causing these problems, patients can go and live their life without any symptoms. Hope this helps. Have a great day.